What are some of the outcomes in regards to perinatal mental health disparities? I mentioned earlier, not everyone is screening. It is important that we screen, that we ask questions, oftentimes because we may not speak the language, we may not understand the person when they're speaking. So that could be one factor, okay? The morbidity and mortality risk also can fuel mental health conditions and challenges. One, because culturally also we didn't learn that it was important to take time to take care of ourselves. That was seen as you're selfish. Why are you not taking care of your family, right? Why are you giving yourself the time to do, go get a haircut, for example, or take a long shower? So sometimes we don't have managing our inflammation or pain, mental health illnesses. There was a previous diagnosis and a person was recommended medication and they're not taking it. That could be one factor. Other dangers in childbirth, potentially memories may emerge from previous childhood sexual trauma. And that could also bring a lot of anxiety when giving birth, okay? There's still a lot of stigma around mental health and seeking support, seeking welfare assistance, or even be part of the child protective services. And what if I say something that I'm having intrusive thoughts, and then the doctor or the nurse or the social worker or the promotora, the health worker, is going to call CPS and my child will be removed from my care. So it's important to bring education, and that's what Maternal Mental Health now has strived to make these collaborations with DCFS to bring these trainings to social workers as well. Also the reduced access. I think that's such a big gap right now that I see across the nation and across many other countries, the limitation of access to care appropriately and in a timely manner. The exposure to other toxic stress, sometimes it could be the relational aspect with the partner, with other family members. What's the word I'm thinking of? When someone is on a temporary visa or permit, right, due to asylum, that's the word that I was looking for. If they're on asylum, all these different pieces can also create a lot of fear and anxiety around safety for the family, right? Not feeling represented, the lack of representation, and the racist messages that continue to, happen in a direct or indirect manner. And what do we families do sometimes, or us as individuals? We suppress those emotions. We pretend that, I should be strong, that if I show any sign of weakness, that's not a good mom as well. So 100% of parents and caregivers and birthing people, everyone, absolutely everyone, deserve to raise their children, their families in a healthy environment, and also to receive proper care that they need in a timely and appropriate manner. Why? Because all of this is preventable. All the parents will get better. And I think that's one of the messages that we want to keep telling and saying, to the families. Not because we suffer or we are experiencing symptoms of depression, that means that it's going to be a label, all over myself, and that I'm going to be walking around with a label. This is temporarily. Sometimes even if the person doesn't have history of mental illness, can still be impacted by this, because there is a surge of changes in hormones, changes in neurotransmitters and chemicals in the brain, and many other factors that could be playing a role. So definitely the mental health will be impacted at some point. But absolutely everyone deserves care.